Affinity is an integrated healthcare system, medical group, hospitals, 3 hospitals, 1 critical access, 2 medium-sized hospitals. We also have our own health insurance plan, network health plan. As we're moving into our medical home model, it's a team-based approach to care. It's patient-centered, physician-led. Physicians will not always see every patient that walks in the door. They want to know how they're doing with their population management. We have we call them RN specialists, also known as health coaches. Those are the ones who are out connecting with the patients, bringing them in, helping them get back in compliance reporting, working with the physicians to manage the care of those chronic diseases that patients have. With the use of electronic records and the ability to hook into the data elements that's in the electronic records that Phytel has, we'll be able to go down to the specific A1C level for diabetic management versus an out of compliance, out of control diagnosis code. So we're very much looking forward to taking that next step and utilizing it as it integrates well into our medical record. We would never be able to make 250,000 calls and staff the cost that it would do if we didn't have Phytel. Phytel provides that resource for us.
My name is Jim McKernan. The company is Healthcare Midwest. It's a multi-specialty group in Kalamazoo, Michigan. We started using Phytel approximately a little less than 2 years ago. We've been very pleased with the product, especially as it relates to return on investment. The return on investment was in less than a year. We were tracking patients in a very disorganized fashion in an individual clinics. Some of them were doing it manually on paper and not doing it well at all. We were facing many challenges as it related to patient engagement of care, especially with our rapid growth. Our company went through 4 successive years with double-digit increases in growth, and managing the patient population became very important to us. The Phytel product has very easily integrated with our electronic medical record. All of our providers are on an electronic medical record, and we're able to track the tests that are performed on the patients and make sure that those patients with chronic diseases are having the appropriate tests at the appropriate time intervals. The patients have accepted the product pretty much right from the get-go with us notifying them when they call into the staff. The ease of use of the product for our staff has enabled the patients to really feel seamless, like seamless delivery of care for them. The product is easy to use for the staff, and therefore it's pretty seamless for the patient. For the physician on the back end, making sure that the patients are getting the studies that they need and making sure that they're getting the care that they need, it's really a win for all involved.
I'm Ed Brown. I'm the CEO of the Iowa Clinic in Des Moines, Iowa. We're a group of 125 physicians. We have about 25 mid-level providers, and we take care of patients all the way from neurosurgery through primary care. The Iowa Clinic was having some problems tracking patients, and the problems that we were having is that while we were providing excellent care by and large to our patient population, we knew that there were cases where patients were slipping through the cracks.
We've been using Phytel for over a year, started in December 2009, and have learned to enjoy it as each month goes by.
I think as we start moving towards population management, we look at the Phytel system as an extension of our practice in managing that overall population and trying to make sure that we're getting patients in a timely manner.
As opposed to us relying on ourselves and our processes, that we feel proud of the fact that we can manage these people and are responsible for them. Phytel does that work of really getting to the bottom of the ones that aren't being contacted on a timely basis and sealing off those cracks that people fall into.
Patients never want to think that they're sick or never want to think that they're not healthy. And so Phytel, by getting them in there, has helped really bring the reality to them that they have a disease state. They need to take initiative in it, and we care that they need to take an initiative, and we really want them to be a partner in this disease state, not a passive participant.
We've talked with Phytel about let's amalgamating Phytel more into our electronic medical record, and we're excited about the opportunities that that might present.
Mankato Clinic is an independently owned physician multi-specialty group practice. We have 80 physicians and 40 advanced practice providers. Several years ago, one of the things we noticed was that our volumes were starting to decline. We had some physicians leave the practice, and we noticed that patients were less likely to come in for some of the care that they needed. And so we started to work with Phytel to help engage our patients and develop a better relationship with them and optimally improve the care. What Phytel enabled us to do was to identify those patients that should have been seen and that hadn't been seen for either preventative services or chronic disease, and reach out to them with a message that says, hey, your doctor cares about you, we'd like you to come in and see us. And as a result of that, they would call us back and we'd be able to schedule them into our clinic. We've seen a significant increase in volume for our providers. Patients in general appreciate a call. Everyone is busy, patients included, and so being reminded of things is helpful. Letting them know that you haven't been in to see your doctor and we'd like to see you, makes them feel cared for. Phytel's been an excellent business partner for us, and as we've developed that relationship and gotten more comfortable, we've been able to even fine-tune some of our work together. So we've been able to take some of the clinical protocols that were in place and even modify them to better meet our physicians' needs and our practice needs.
AMGA is a medical trade association. We've been around since 1950. We have about 390 medical group members. These are large integrated delivery systems and other organized systems of care. Those 390 physician practices have about almost 120,000 physicians in them. So my members take care of about 1 out of every 3 Americans. Today, with scarce resources and an eye on improving the health of a population, the medical groups are really standing back and taking a look at the continuum of care and across a population of patients. So information technology is really helpful in that regard, because for the first time they can look longitudinally across all of their patients and see where they stand in a continuum and how well they're doing on outcomes. So what you need is the technology that enables you to be able to first identify those patients and then second to bring them into the practice in a timely fashion. One tool we looked at a couple of years ago was Phytel and their outreach program that's technology driven. And AMGA and Phytel actually formed a partnership, and we're very pleased with that partnership because this partnership has been very beneficial to patients as well as to our own organizations. We've seen this grow from 2 organizations a couple of years ago to now more than 50 AMGA members are participating in the program. It works. It does exactly what we had hoped it would do in terms of bringing patients in who are at need and helping them to avoid adverse events. The thing is about identifying those patients who are at need, identifying those patients who really don't have the services they need in order to avoid adverse events and bring them into the practice. Right now, that's a win for everybody. You generate revenue for the practice because you're billing for those services, but more importantly, you're bringing patients in, they get care, and they avoid a very serious adverse event. Nothing could be better.
Olmsted is a nonprofit integrated health provider with about 16 locations of both ambulatory and hospital services. As we've increased our focus on chronic disease management, particularly diabetes, we were looking for ways to better manage our patient population. The other issue we were facing is time utilization by our physicians and decreasing no-show rates so that we could increase our overall productivity at Olmsted Medical. We're using both the Phytel reminder system as well as the outcomes project. And with reminder calls, we have used a phased approach for that, as well as the outcomes database. We are expanding that to additional primary care departments. The implementation with Phytel was extremely smooth. Very little work on Olmsted's side, probably a lot of work on Phytel's side. We were a little nervous as far as getting it up and going, how long it would take and what resources of ours it might require. But it was very smooth and with very little hitches along the way. One specific anecdote that a physician shared with me was a patient that had difficulty managing many of his health issues. And he got the call from Phytel. He came in. His wife and daughter were in the lobby hooting and hollering and very excited that finally we got this fellow in, and we're able to put in place some care management for him to improve his health care.